Hi, so my name is Noor El-Dassouki, and I work at the University Health Network Multi-Organ Transplant Program. And I'm going to be talking about my poster, which is analyzing the association between sex and readiness for living donor kidney transplantation. So this analysis was based upon the evidence-backed fact that living donor kidney transplantation is the optimal treatment option for eligible patients with end-stage kidney disease. However, we've identified various barriers to living donor kidney transplant and the fact that not all patients have equitable access to living donor kidney transplant. So as a result of this, we wanted to look at the impact that sex may play in accessing living donor kidney transplant, as various other analyses that were performed in the US and in Europe have shown that women tend to be less likely to receive living donor kidney transplant than men. So we looked at a cohort of patients from the Toronto area, Greater Toronto area, who are receiving dialysis and who have been referred for pre-transplant assessment. And what we found was that patients who were female did not show much difference in terms of their likelihood of having a potential living donor identified, of having an offer of living donor kidney transplantation, or in their overall readiness for kidney transplant. We did see, in fact, that females tended to be more likely to have a potential living donor identified than males, but in terms of the other predictors of access to living donor kidney transplant, including transplant readiness, there was actually no significant difference between males and females, which is a good sign because it shows that there are likely minimal disparities in access to kidney transplantation between males and females in this specific context. So in the future, we will definitely need to conduct future analyses looking at this association to make sure that our findings are correct in this context, and hopefully we can continue to work to reduce any other barriers to living donor kidney transplant so that all patients are able to access equitable care.